Welcome to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and I'm here with my co host, Veronica McNally. And Veronica, a very interesting show coming up.
That's right. We'll be talking to four guests today about keeping families safe through vaccination.
We'll get started right after these messages. Welcome to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas. I am here with my co host, Veronica McNally. And Veronica, on this edition of the show, we're talking about keeping families healthy and safe from vaccine preventable diseases. Our first guest is Dr. Sheala Jafry. She is a family medicine physician with Beaumont Health Family Medicine Residency Clinic in Sterling Heights. Welcome to the show, Doctor.
Thank you for having me today.
And I'm going to let Veronica kind of kick off the questioning here. Go ahead, Veronica, take it away.
Great. Hi, Dr. Jeffrey. I am really interested in understanding where things are right now with COVID. I've heard that cases are on the rise, and I'm wondering what you're seeing on your day-to-day in practice.
So recent articles and recent numbers, it's slowly ticking upward a little bit from the current Free Press article from the end of April till now. There's been a 20% increase in the numbers. But due to vaccines and people having prior COVID, there's less ICU admissions, less patients on the ventilator. And thank goodness for home testing. People are testing at home and then staying home and masking. So the vaccines are working, and people who need to get a booster should go get their booster sooner than later.
When patients come in to see you right now, and you're testing them for COVID, what are you seeing in terms of a positivity rate?
So patients usually, if they are having symptoms of COVID, we do a phone or video visit still, depending on where you are clinically in an office setting. But most people that are testing have either been exposed to someone, need to be tested for work or travel. And some people are just having mild symptoms like a sore throat, cold symptoms, mild fever. And thankfully there's testing and they can do the rapid test or go to an urgent care and get a PCR test.
Is there anything right now that kids are able to do for maybe to help them get over it quicker? Are there anything you're telling parents to do?
I think the biggest thing is if you're in surroundings where you don't know people, wear the mask, especially indoors in crowded situations. And with any viral illness, staying hydrated, getting enough rest, getting vitamin C, eating healthy. But the biggest keys are hydrating, resting, and taking care of your body, good hand washing, and masking.
So for the parents who have children under 5, what are they saying to you about COVID and COVID vaccines?
A lot of people are waiting for the approval because they want to get their children vaccinated. We're keeping an eye on the studies and we're educating. The biggest thing is to ourselves get vaccinated so we can protect our elders and our children. If you're in big crowded areas, keep the mask on to protect yourself and others. Evidence shows it's protective for us for not getting the disease, and it's protecting other people if you're an asymptomatic carrier, not giving someone else the disease. And, go outside, enjoy the fresh air. Outside is good. And know the people who your cohort is or who your surroundings are.
Yeah, that's great. I know Anne is a grandmother, and I know she has some questions for you too.
Sure.
Doctor, how are parents doing just getting regular childhood vaccinations for their children? Are they starting to get caught up, or are you still seeing a lag with regard to that?
There is a lag still from 2020, and I look at patients' charts, and a lot of people haven't been in for a year or over a year. There's been multiple reasons. When COVID started, we started doing video visits and phone visits, and then people slowly started trickling in. But a lot of the older people, geriatric people, are afraid to still come into the clinic. But we're telling them, mask up. If you're vaccinated, come in. And most clinics are like a green zone. If you have a cough or a fever, we switch you to a phone or telephone visit. All the patients are screened before they come into the facility. And that's why we have the urgent cares for people to get tested. And the urgent cares have you wait in the car. and they'll tell you when it's your turn to come into the room, and they'll test you. So it is sad. A lot of everyone's behind. People are behind with their mammograms. People are behind with their vaccines. Call your doctor, make an appointment, wear a mask, go get checked out. People are behind with their flu shots, their pneumovax shots. And the wonderful thing is there's COVID vaccines at pharmacies, at grocery stores. The access is so much more available than it was 2 years ago. So it's out there. Just call, make an appointment, go to the local pharmacy, call your doctors and make your appointments and get checked out. We all need annual physicals to help prevent disease and do screening. So please call your family medicine doctor, your IM doctor, your pediatrician, and get in and prevent these diseases that are totally preventable.
Well, why do you think parents are behind with regard to getting the vaccines for their children? Do you think it's because of COVID, they're afraid to come in, or do you think there's a vaccine hesitancy problem out there? What are you seeing?
I think it's a combination. I think a lot of people are working from home and they're multitasking, so they can't get to the doctor's office. We're all working like 9 to 5 from home. The kids are back in school. There is some vaccine hesitancy, but I think the biggest advocate is yourself. And I tell everyone I'm vaccinated, my children are vaccinated, my mom is, my in-laws are, everyone in our family is vaccinated. And mild side effects, just like the sore arm. But biggest thing is education. And number 2 is asking why they don't get vaccinated. What is your why? What are you scared of? What did you hear or read? And the biggest thing in 2020 and 2021 is when I would get those phone calls, I would ask them why, reassure them, and then I would go over their history. Okay, you're diabetic, you're elderly, you're on chemo. Why do you not want to get vaccinated? Don't you want to see your grandkids? Don't you want to go back to seeing your family? And thankfully, a lot of people understood, because everyone hears that story from a friend, and it's just like, is that a reliable source? Always check the source. Is it an official study or is it hearsay? And I think the hearsay is what scares people. Like, heard this on YouTube, or a friend told me. Who is that friend, and is that real? So check your sources, ask your doctor, ask someone you trust who's in the field and has been personally and professionally dealing with this.
Behind the scenes, what are the conversations with regard to a possible new updated COVID vaccine coming soon?
So it's still in trials. There's research going on because there's different variants. I did speak to Dr. Gilpin last week, and they're still in the works for the newer vaccines.
But do you think we'll probably see something maybe in the fall or the winter of next year that'll be updated, and then we'll be getting, like, let's say, a yearly COVID vaccine?
Hopefully, yes. I think that's where we're going towards, just like the annual flu vaccine, because there's a shift, like a mutation, and it changes. So I think we're going to have the same thing with the coronavirus. But I will say people over 60, people that are immunocompromised, people in the healthcare system, please go get your booster if you're due. Mine's coming up in May for my second booster, and I will go get boosted.
And you're gonna do it no matter, even though it may not prevent you from getting COVID, it will definitely help keep you out of the hospital.
That's the biggest thing. It decreases the severity, right? Even right now, the ICUs are not filled. People are not going to the hospital, depending on your comorbidities. Like, if you have diabetes, hypertension, asthma, those people are getting better at home with care, with family care and people taking care of them. So I think if you've had COVID, you should still get vaccinated, and then you're super immune. You have natural immunity and the vaccine's immunity.
Dr. Sheala Jafry, family medicine physician with Beaumont Health Family Medicine Residency Clinic in Sterling Heights. Thank you for the great advice and for your time today.
Thank you.
You are listening to Why I Vaccinate. We'll be back right after this. You are listening to Why I Vaccinate, and I'm here with my co-host, Veronica McNally. And Veronica, we now welcome to the show Dr. Andrea Amalfitano. He is the Dean of the Michigan State University College of Osteopathic Medicine, and he's here today to talk to us a little bit about trusting vaccine research. Welcome to the show, Doctor.
Good morning, everybody. Pleasure to be here.
And Doctor, I'm going to let Veronica kind of kick this off. She's a fellow Spartan, And so I'm going to have her kick off the questioning.
One,
Doctor, can you talk to us about how you became interested in vaccine research?
yeah, I'm actually Dean of the College of Osteopathic Medicine, but I'm also alumni. I went here for my medical school training. As part of that, I did what's called a DO PhD training program where I got my medical degree, osteopathic medical degree, simultaneously with a PhD in microbiology and molecular genetics.
Wow.
PhD studies were focused on developing viruses as therapeutics. And as part of my research, I've developed a number of technologies based on this that are actually in clinical trials using these novel platforms to basically elicit beneficial immune responses to treat a variety of diseases. So some of that technology is actually being used in patients with cancers to get their immune systems to fight their cancers. There's about 28 clinical trials underway right now across the United States using this technology. Similarly, the platform can also be used for infectious diseases, and we're testing it for COVID, for example, as one example. We've used it for flu vaccines and other infectious diseases as well. So I spent, let's just say, I spent a lot of time studying viruses and infectious diseases, even genetics. I'm a clinical geneticist, right? So I've trained in pediatrics and understanding how genes are involved in human disease. Just trying to pull that all together.
So, when COVID first came to the US and you started to learn months later about the development of a vaccine and the mRNA technology, what were your initial thoughts?
Well, my thoughts were twofold. First of all, RNA technologies have been used in humans for decades, so I was comfortable, very comfortable with their safety profile based upon that study. So even though folks sort of originally were like, "This is a new technology," actually it's not. It's been around and studied for, like I said, decades, and so we had a good, strong understanding that they are very safe based upon a number of human studies in the past. Um, Second thing is the ability to scale it up rapidly for use in an acute situation, which is this virus is coming into the population rapidly, hadn't been there before, and we have to develop a vaccine for it. And so this sort of technology is able to be ramped up uh, uh, rather rapidly. So you have a strong history of use in humans, and the FDA and other agencies are well aware of that and take that into account, as well the capacity to ramp up and test in the actual context of a human trial. And so that was very comforting to me to know that that was coming. The other element of this that I think is a question that parents have is, well, yeah, actually, it was ramped up fairly rapidly if you think about the history of vaccines and how long they usually take. And what I would like folks to understand is that the actual studies themselves were done in the appropriate time period. The numbers of patients that were brought in are equivalent to what I've seen in other studies. What was decreased in time was the review. Sort of the bureaucracy was removed in the name of let's get this to patients as soon as possible. Didn't sacrifice anything as far as the how deep and how detailed those studies were conducted. It was just the time period from going, let's say, a phase 1 study to a phase 2 study, then a phase 2 study to a phase 3 study, and then the final approval. Those timeframes in between those transitions, primarily done by the FDA, were decreased by just having a lot of folks all hands on deck. Let's look at the data. Let's look at this where it usually would take 6 months. We do it in 2 months. The same data is looked at, the final conclusions are made, but we decrease that time frame to allow this to get to patients sooner rather than later.
What do you think, in your experience and having discussions about this vaccine, what do you think are some of the most effective things to tell people who are hesitant about the vaccine?
I think a couple points to keep in mind is one, as I mentioned, this isn't a particularly novel technology. The RNA-based vaccines, like I said, have been studied in a number of other clinical trials in the past. And so the FDA was very comfortable with that, having that background to allow this to proceed forward. The other thing is that coronaviruses are difficult to target with vaccines. For example, when I lecture to medical students on this topic, there's actually been a number of coronaviruses that circulate around in the human population that cause typically the common cold. And they can recur in folks who've had it maybe once and then 9 years later they get it again. The biology of these viruses, the way they've evolved over time, allows them to sort of sneak past the immune responses that we get and allow you to get reinfected again. And so that's what the vaccines are dealing with, is you have this natural sort of evolutionary biology of these viruses to evade immune responses, even if you've had the virus in the past. The vaccines minimize the chance that if you do get reinfected, that the severity of that infection will be significantly decreased. And so that's what we're really after with any vaccine, really, is to minimize the effects that should you encounter the virus naturally, that you don't have a bad outcome, especially if you have an underlying health condition, you're immune compromised, you're elderly, you have something else going on that you may be at higher risk to have a more worse outcome should you encounter the virus.
Yeah, I think those are really important points. I know Ann has some questions for you too.
Yeah, no problem.
So that leads me to the question about the second booster. Number
Mhm.
one, who should be getting that booster? So that's the first thing.
Yeah, I think right now the recommendation is anyone over the age of 50, folks that are immune compromised. So let's say you're on a steroid treatment for autoimmune disease, you might have a kidney transplant, or even a cancer treatment. Most cancer therapies, immune compromised folks. Those are the main folks that are being targeted, as well. Healthcare workers should be looking at that as well. So we're really trying to minimize those most high risk populations, as well decrease the spread in healthcare settings.
What about if someone recently has contracted COVID? Should
Mhm.
they still consider getting that second booster, doctor?
I would say yes. There is a time frame that you should wait from the time you're infected to the time you get a booster. Um, uh, and actually, just to make sure that the vaccine has the best chance of being effective. Um, and as I mentioned earlier, these coronaviruses, they're wily. Okay, they have evolved to actually do this. As I mentioned, you could be infected, and then 7, 8 years down the road, your immunity wanes, decreases, and that allows then the virus to have a better chance of reinfecting you. Um, and that's part of the issue. I think some of the hesitancy that we talked about earlier,
Yes.
that folks are like, well, I got this vaccine, I hear this vaccine, and people are still getting infected. And that can't be used as a reason why I'm not going to get vaccinated, because you need to be very specific. You need to understand that, yeah, maybe you did get reinfected, but it wasn't as severe as what it would have been. And in fact, you may have not even been symptomatic, whereas you might have been had you not been boosted previously. And so I think some folks are really working in absolute terms sometimes in making their decisions, and we need to be clear. And this is not unusual. In fact, I welcome it as a physician. If a parent has a question, I want to know, because it's your child, your grandmother, your loved one, and the last thing we want to do is make you feel uncomfortable. So as a pediatrician in the past with other vaccines, the measles, mumps, rubella, the chickenpox vaccine, the rotavirus vaccine, human papillomavirus vaccine, these questions are not new. And questions about what was the safety profile like, what was the clinical trial like, what's the benefit, what's the risk. I've given lectures. Folks have been worried about linkages to autism, for example, and I've studied that up and down, and there's no link at all. But you work with parents because these are their family and their loved ones, and I want to be a partner with them. And that's why I spent so much time going to school, to try and make sure I understand so that I can then translate that information to families as they approach us. And hopefully, in the end, we can all come to a conclusion that everybody is happy with and comfortable with.
One of the things that I've heard people say recently that I would like you to address for us is they say, well, by getting all these vaccines, you're actually making yourself more vulnerable
Oh,
to COVID. And I hear it all the time lately.
yeah.
Will
Yeah.
you address that?
Yeah, sure. First of all, that's false. So I'll just say that right off the bat. But think about it this way: our immune systems, actually, the immune system is one of the most incredible systems in the body, just from a nerd biologist point of view. But your immune system is constantly bombarded with what we call antigens, okay? When you eat, bacteria are coming into your body, plant antigens are coming into your body. You breathe, you're breathing in spores and mold and whatever else is floating around on your skin. And your immune system, in your gut in particular, your immune system is constantly processing these antigens day in, day out, 24/7, never stops. Um, and so getting a vaccine is just another antigen in a sea of antigens that your immune system is dealing with on a constant basis. It can handle it. Don't believe you me. No problem here. It's not going to be overwhelmed. I know this comes up. It's a fair question, right? You bring your baby in at the 2 month or 4 month, and the doctor is saying, okay, we're going to give you a vaccine in the left arm, a vaccine in the right arm, another vaccine in the thigh. It seems like a lot, but in fact, it's a minor, really challenge to the immune system. Uh, I think the other part of it is you have to understand how vaccines are designed. They have two elements. They have an element to sort of wake up the immune system, and here comes an antigen that we particularly want you to pay attention to, be it targeting measles or smallpox or rubella. Um, and the combination then is what stimulates the immune system to make a really good immune response should you encounter that virus or pathogen down the road. And sometimes in that process, when someone has a slight fever or aches in the arm, other side effects, that's actually meant, it's intentional. It's sort of waking up the immune system to say, hey, and pay attention to this antigen in particular, because should you encounter it again, you want to be ready at the get-go.
Dr. Andrea Amalfitano, the Dean of the Michigan State University College of Osteopathic Medicine and an expert in vaccines, vaccine research, and infectious diseases. Thank you so much for your time today. It was really great speaking with you.
So my pleasure. Anytime.
You are listening to Why I Vaccinate. The conversation will continue in just a few minutes. Our next guest, Veronica, on Why I Vaccinate is Will Cwikiel. He is the superintendent and the principal at Beaver Island Community School. And it's my understanding you met Will at the Hometown Health Hero Awards ceremony. So I'm going to kind of let you introduce Will more to our listeners.
Yeah, thank you. I met Will because he received an award and he really just had this incredible accomplishment of getting 85.8% of the residents on Beaver Island vaccinated against COVID. So
Oh.
I wanted to talk to him and I wanted our guests to hear about it. Will, for those people who've not had the pleasure to be a visitor to Beaver Island, can you tell us about Beaver Island?
Sure. Great. First of all, thank you guys for having me. It's a pleasure to be here. I'm a huge, back when I was a kid, I grew up listening to WJR, so it's great to be here. Um, so Beaver Island is, it's the hidden gem of the Great Lakes. And a lot of people have heard of Mackinac Island over in the Straits of Mackinac. Beaver Island is 35 miles off the coast, 35 miles from Charlevoix. In northern Lake Michigan. It's the largest inhabited island in the Great Lakes on the Canadian, or I'm sorry, on the U.S. side. The only larger island is Manitoulin Island in the Great Lakes up in Ontario. So it's sort of like a step back in time. People take care of each other. We have about 450 year-round residents. The ferry is a 2.5 hour, 2 hour and 25 minute ride from Charlevoix. It only runs about 7.5 months out of the year. The rest of the year, the only way to and from the island is via airplane. So it's quite remote, but a really special place surrounded by beautiful Lake Michigan. Just a wonderful community to live and to learn.
So when COVID hit, what were you thinking?
Well, when COVID hit, there were two thoughts. One is, oh my goodness, if COVID comes to the island, given how close knit everything is here, it could really sweep through the community. But on the other hand, we thought, well, we're also somewhat isolated from the rest of the world, given the transportation via plane and boat. So there's perhaps are somewhat protected as a result of that. So on both fronts, it was some concern, but we were really happy to be able to come together as a community and a lot of thoughtfulness and care for each other throughout the entire pandemic.
So March of 2020 is when things shut down. When did Beaver Island have its first case?
We had our first case in the summertime. As far as we all know, there were some folks that came across on the ferry, a family that was coming to stay and they got the news of the positive PCR, I guess, while they were on the boat. So they quarantined the entire time while they were here, and then they left on the boat, stayed in their car on the way back. So there were no cases as a result of that. And then we did have a bit of a localized pandemic during deer season that fall of 2020. We had some folks come over and guys visiting deer camp and ended up infecting, I think, 18 or 20 people in that one weekend. So that was, affectionately referred to as the deer season fiasco. But it really did show people that we were not immune from this and that things could spread very, very quickly if indeed there was community transmission on the island.
So I know that Anne has questions for you too, and I'm going to turn it over to her. I think the pressing question is how you did it.
Yeah, and it's so nice that you talk about how everyone cares for each other. That seems to maybe be the secret sauce here.
Yeah, it is such a small community, and particularly in the wintertime, when the boat stops running, we have to rely on each other and count on each other. And what I found through the school was a way to bring people together. So regardless of their political views, regardless of their views on vaccinations, I think a lot of people got vaccinated who otherwise wouldn't have, just because they wanted to keep the schools open. We stayed face to face throughout the entire pandemic. Whenever we were allowed to be face to face in school, we were. So that first spring in March of 2020, of course, we had to close down. But starting in the fall of 20, we stayed open and had face-to-face instruction the whole time. So my message was, hey, if you're not going to do it for yourself, do it for the kids. The other factor I think is really important is we have a lot of elders on the island, a lot of folks that are in that age group, and people care about them. Even though someone individually might not have been interested in getting vaccinated, they realized that if they could do it and it would help the elders on the island, then they went ahead and did it.
So, Will, when you had someone who was a little bit resistant or reluctant, what were some of the phrases or what did you say to them? How did you kind of convince them to, hey, help us out?
Well, I want to just be real clear that this wasn't just me. We had, the great, great, great help and support of the Beaver Island Rural Health Center. An amazing, amazing job by the Health Department of Northwest Michigan. They realized right off the bat that Beaver Island, because of its isolation, particularly when the vaccines were first available, they prioritized getting over here and doing vaccine clinics on the island, and we were able to have those at the school. We were able to get the word out through our parent network. There was a lot of individuals talking to each other. We had folks coming in. Well, my wife's making me come in to get vaccinated. I hate vaccines. I hate shots. Blah 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 blah. But but it was that personal touch, people communicating with each other. And I think the other factor, we had lots of volunteers here on the island who were longtime islanders, and they would literally call people up and say, "Hey, we just opened up a vial. We've got 6 more doses or 5 more doses that are going to go to waste if you don't get in here." And they were literally calling people on the phone to get them to the vaccine clinic before the nurses from the health department had to fly off to go back to the mainland.
Wow.
So that personal touch and really keeping politics out of it. It's like, okay, we don't care who you voted for. We don't, it's all about this is an opportunity to help protect yourself or others. And that really seemed to work. That personal touch just really seemed to work.
Will Cwikiel, the superintendent and principal at Beaver Island Community School and a Michigan hometown health hero. Thank you so much for your time. It was really great talking to you and getting your advice on how to deal with COVID.
Well, you're welcome. And thank you so much for all the work that you guys do. And anything I can do to help in the future, please give me a call.
You're listening to Why I Vaccinate. Back right after this.
You are listening to Why I Vaccinate, and we are going to be talking now about COVID protection for our youngest family members. I'd like to introduce you to Lynn Bahta, who is an advisory committee member for the U.S. Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. She is also the immunization clinical consultant at the Minnesota Department of Health. Welcome, Lynn.
Thank you for having me.
There is a lot going on right now with vaccines, especially right now, vaccines for kids. When we started the show back in spring of 2021, there was not a COVID vaccine yet for kids 5 to 11, and older kids had just recently been able to begin to be vaccinated. What do you think we are going to see in terms of timing for the review by the FDA for Moderna?
Oh, that's the $1 million question, isn't it, Veronica? We've heard that Moderna was going to be submitting their information, and so it's a matter of time for the FDA to go through that review process, go through all the data. We're hearing that there are some FDA meetings scheduled throughout June. So it's very possible that one of those meetings could be a discussion about the Moderna vaccine. And if it's authorized for the children 6 and under, we might have a vaccine for kids as young as 6 months. But, in sometime in June is what I am hearing. Sometimes we hear the information direct from the New York Times. So it's been really hard to predict when things are coming out outside of what we're hearing in the general media.
Yeah, and I think it's really important for families to understand the role that FDA has in this and then what CDC does. So just by way of background, we know that VRBPAC will see the data first, and it will review the data and it will advise the FDA, and then it goes to the CDC. And can you talk about what the committee that we are on does when we happen to be asked to address the issue?
Mm-hmm. Typically, we are given a package of background information. And so that's typically if there's any publications that have come from the research that has been done. We often have access to the briefing information from the FDA. And then during the meeting, we're presented with certain things that allow us to consider how to use the vaccine. And in these situations, we're looking at how severe the disease is. And so what impact does this have on certain populations? We know that in the past, coronavirus hasn't landed children in the hospital as much as it's landed our seniors and people who have other health conditions. But we also do see children ending up in the hospital, and we have seen children die from COVID. And so we're weighing the risks of the disease against the benefits of vaccination and the risks of vaccination. And so that is data. It's data about diseases and data about the vaccine and the vaccine side effects, and if there's any other concerns about the vaccine. We look at how should that vaccine be made available. Are there certain groups we need to pay attention to because either because of their risk or because of the they may be disenfranchised. They may be in disadvantaged communities where they just don't always have access to the vaccine. So there's quite a few things that we actually consider during that meeting to think about what kind of recommendation we want to have. And once the decision's made, there's an ongoing evaluation afterwards of the safety of the vaccine and the usefulness of the vaccine. Something that we're seeing and had a discussion about was how the variant Omicron has uh, been able to elude our immunity against coronavirus, both if we had the disease or if we'd been vaccinated. And how do we handle that? And do we need to be making different recommendations? What tools do we have in terms of vaccines that could be to the advantage of people in building protection that they've gotten from vaccination? Is it still protecting against serious disease, meaning disease that ends up lands you in the hospital, or you could die despite vaccination? So those are all things that are ongoing even once a recommendation is made.
I know Anne has a couple questions for you.
Yeah.
Lynn Bahta, are we going to see another vaccine maybe in the fall, the winter, or maybe next spring that's updated and that will address some of these concerns that you're talking about?
That certainly has been discussed. I think that we need to understand where the direction that this virus is going, and that's challenging when you
Right.
have a brand new virus. And what we're learning is that right now it seems to be mutating fairly quickly,
Mhm.
and as a result, we can't always predict as well what direction it's going to change. Is it going to become more infectious like the Omicron strain, or is it going to be a more serious illness like the Delta strain or Delta variant? And so I think that it's a race for time and prediction. But we really need to know this by June in order to have something available for the broad community who's already been vaccinated, to make it a useful vaccine. And I don't have the answer to that. I think that that's where there's got to be a lot of cooperation globally and nationally
Yeah.
between the people that do produce the vaccine and the scientists, who are trying to understand where the variant changes are going to occur.
Sure. Lynn Bahta, immunization clinical consultant at the Minnesota Department of Health. She's also on the advisory committee for the U.S. Centers for Disease Control. Thank you for your expertise today. It was very interesting hearing what you have to say about this, I would say, puzzling disease.
It is puzzling, and that's part of the nature of the newness of it.
Yes, yes. You've been listening to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and on behalf of my co host, Veronica McNally, thank you for listening, and we hope you have a great day.